welcome Dr. Naveen Sangji. Dr. Sangji is on faculty at the University of Michigan. She recently completed her training in general surgery, where she also got an MPH, stayed for fellowship in burns critical care at Massachusetts General Hospital Harvard System, and is now on faculty at University of Michigan. Welcome.
Thank you, Dr. Wexner.
An impressive starting track record with a lot of options in your career, having been trained in general surgery and burns critical care and having an MPH. In what area was your MPH?
I did health policy and management with a specific focus on management.
And also clearly a focus in leadership, at least in your personal life, because you chair the Resident and Associate Society for the American College of Surgeons. I enjoy hearing your reports at the Board of Regents. You seem to have a very energetic group of people. So I'd like you to tell us a little bit about the RAS, about the structure of the RAS to start.
Sure, thank you, Dr. Wexner. So the Resident and Associate Society is part of the American College of Surgeons, the arm that caters to all trainees in surgery, residents, fellows, and junior faculty who are not yet ready for fellowship. Our constituency is around 13,000 members in the United States, of which approximately 8,000 members are residents, and the remainder are associate members, which means junior fellows and junior faculty. We provide a lot of programming to support our residents, as well as opportunities for residents to get involved in the American College of Surgeons, as well as to have career development opportunities. So the structure of RAS includes 5 standing committees. These are the education, the advocacy and issues, the membership committee, the communications committee, and the 5th committee is an associates committee, which is meant to cater to residents and fellows who have completed their training and are junior faculty and planning to apply for fellowship in the college, understanding that their needs are slightly different from those of trainees. So we have a separate committee for those. These 5 committees meet by conference call once a month on a Wednesday night of each week, and offer a host of programming both throughout the year and at Clinical Congress each year. We offer several scholarships throughout the year. So for example, for attendance to the Leadership and Advocacy Summit that's held in DC by the American College of Surgeons, the Quality and Safety Conference, the Residents as Leaders Workshop, and so on. We also have representatives to every standing committee and Board of Governors work group of the American College of Surgeons. This allows two-way communication between the leadership of the college and between residents and trainees and associate members of the college.
In addition to representing the various facets within Board of Governors structure with the pillars from your description, you also are representing surgeons not only in different points in career, residents in training, fellows, and young faculty, but also general surgeons and specialists. Could you talk a little bit about how the House of Surgery, as we talk about it very often, how the House of Surgery is brought together within RAS?
That's a very important point. I would emphasize that RAS-ACS, and certainly American College of Surgeons, this is not a professional society for general surgeons, but for all of surgery and all surgeons. The Resident and Associate Society likewise welcomes specialty and subspecialists from all disciplines within surgery, for example, urology, neurosurgery, OBGYN, and our programming is inclusive. So for example, the Leadership and Advocacy Summit scholarships are available and helpful, I think, to surgeons in any field, to physicians in any field. And so our programming offers something for everyone within the House of Surgery. We also have liaison positions for all of the subspecialty societies. So for example, we have a liaison to urology, neurosurgery, and these liaisons attend their own society meetings and liaise with the American College of Surgeons to allow two-way communication. our own leadership for committee chairs as well as for the RAS exec. We welcome and routinely get interest from subspecialists as well as general surgeons. So we try to be very inclusive, and we have good representation. We welcome more representation. So if you are a subspecialist and are interested in being more engaged and involved in RAS, please reach out. We would love to get you on board, and we have lots of opportunities for you.
Tell us a little bit about some of the programs, some of the actual activities that you're doing within, for example, education, within advocacy, because you may be dealing with a population where there's no background in putting those things together. For example, going to Washington, D.C. or assembling some type of an educational event. Let us know some of the things that have been done in recent years.
I will start by saying that getting involved is a lot easier than it may sound. When I first became a member of the Resident and Associate Society, I was already in my research time, and already, I was a member as an intern, but when I became actively involved, I was already in my research time and a fellow with the Division of Advocacy and Health Policy, and that's when I realized that there's an active committee called the Advocacy and Issues Committee within RAS. And it was really easy to get involved. It really, all it takes is dialing in on a Wednesday night. It's a standing call the first Wednesday of every month. And you join on a conversation with other members of the committee. It's an hour-long call led by the chair of that committee. And we discuss programming and opportunities. The first few times I called in, I just listened quietly and just shared my name during attendance. And then as people discuss ideas and programs, something might spark your interest. You may have an idea that you wish to contribute, and then you speak up. And then the next time at Clinical Congress, you raise your hand when they ask if you want to run for secretary. And that is literally how I became eventually chair of advocacy issues and chair of RAS, by just raising my hand at one of the Clinical Congress meetings and getting involved. So in terms of the programming that I've been mentioning, let me start with the Education Committee. Every year at Clinical Congress, they are responsible for the Surgical Jeopardy program, which you might be familiar with, having attended Clinical Congress as a RAS member. For the last 3 years, we've also been offering, through our Education Committee, a skills competition known as So You Think You Can Operate, where we have 8 teams who apply to participate in this competition by submitting videos of skills. We encourage teams from chapters and teams from programs to participate, and we select the best teams. They come, they have this engaging and active and fun competition at Clinical Congress, and then the winning team gets the honor of having won a skills competition as a surgical team. So it's a really fun experience, and that's one of the more recent programs that we've started, and I look forward to continuing. During the COVID pandemic, during the height of the pandemic, recognizing that resident education was being disrupted, our Education Committee hosted weekly curriculum meetings through webinars and discussed, for example, gastric cancer or another topic of interest. And these have been very well attended. We started with a pilot of 5 sessions, one per week. And because of ongoing interest, we have continued them and anticipate hosting a total of at least 12 sessions with plans to reassess at the end. So those are just some examples of just one of the committees within RAS. The Advocacy and Issues Committee is likewise very active. Most recently, they are working with the ACS Committee on Trauma to develop podcasts around firearm injury. And these are nonpartisan, non-political podcasts that discuss literature around firearm injury. As surgeons, trauma surgeons, and first responders, it's important to understand literature and data, and so that is one of the projects of the Advocacy and Issues Committee. Our membership committee, recognizing that incoming surgeons who are entering our field have, because of the pandemic, lost the opportunity to celebrate their graduations, a huge accomplishment. And so we're hosting a virtual graduation ceremony for them through that committee. So all of our committees offer something special throughout the year, new programming as it's suggested by members. And then during the pandemic, programming specific to help our constituency. So I really hope that if you're interested, you will reach out and get involved.
Speaking of health and speaking of programming, do you have any formal programming for wellness, for work-life balance, which certainly we hear about as being a very significant topic of conversation, particularly within RAS and YFA? We try to be conscious to ensure that we can ensure an environment, obviously, in which residents and faculty can achieve the desired work-life balance. Does RAS have any programs in that area?
Yes, thank you for that question. We do, and first, and we appreciate actually the support from college leadership in our discussions around wellness and work-life balance, particularly of the Board of Regents at our last meeting. These topics were brought up on behalf of the Resident and Associate Society. Each year, our communications committee puts together a bulletin topic that is dedicated entirely to contributions from, almost entirely to contributions from the Resident and Associate Society. And our theme last year was wellness. And so all of our committees and our members contributed to that. This year, we've had ongoing webinars on wellness and work-life balance. During the pandemic, recognizing a need to have a space for our constituents to share stories, hear other people's stories, and to connect. And we hosted several hangouts on that were called just meant for people to hang out and decompress. That's what we called them, and that's what people did. So certainly, we are very cognizant of the challenges that trainees, faculty, young faculty, mid-level faculty, and faculty in the later stages. Of course, we all face challenges, but as the RAS, we are very cognizant of the challenges that are particular to our younger constituency, and we try to host programming around that.
I know that the college is increasingly international. It's called the American College of Surgeons and started in North America, US, and Canada, but increasingly every year we see more and more of the new initiates who are from overseas. Do you include residents and associates from overseas? And if so, what's the sort of percentage distribution between North America and elsewhere?
We do include our overseas colleagues and welcome them warmly into RAS. On top of my head, I don't have numbers, but I can look this up. We have programming that encourages exchange with our international colleagues. So for example, we have scholarships that called the International Exchange Scholarship, where members of RAS go to different countries and attend meetings, surgical meetings in the host nations, and we select members from those countries who can come and attend clinical congress as invited guests of RAS. And so there's an essay competition that goes out each year to allow this two-way exchange. But we warmly welcome our international colleagues, and we appreciate working with them.
Excellent, and you don't have to look up any numbers. It was
throw that in there.
more of interest, and I appreciate your enthusiasm. The last question I'd like to ask is, when you speak to residents who are not, or young faculty, anybody who qualifies for RAS, residents, fellows, young faculty, and they're not members, what do you tell them? What are the reasons for membership?
So if there are young residents and faculty who are not members of the College of Surgeons, they usually wouldn't tell me that. But if they did, I would encourage them to get involved for some of the reasons that I just shared. The first is that membership, the dues are $25 per year for a resident. Often the training program will agree to sponsor or allow CME funds to be used for those dues. And I look at it, I think of it as an investment in career development and in our future. I think of RAS and the American College of Surgeons as a house for surgeons outside of our institutions, and for residents and trainees, a home away from our training programs. And what I mean by that is that RAS-ACS and the American College of Surgeons not only offers career development opportunities, but it also offers a network for us that can support us throughout our careers. So what I mean by that, for example, I personally first learned how to design a workshop because of my work and involvement with the RAS-ACS. And the leadership of RAS, when I was a younger member, taught me and helped me with that process. And now I and others can pay it forward for the upcoming members of RAS. These are important skills that we bring with us to our hospitals and can take with us throughout our careers. The leadership development opportunities through attending conferences, those are invaluable. And then we can actually form a true community for ourselves outside of our institutions that is really valuable. So for example, the bulletin contributions that the RAS makes every year, those are collaborative work products where multiple members of RAS who have likely never even met each other work together and produce an article that is revised and edited and polished and submitted to the bulletin for publication. That helps develop camaraderie and a network and a group of friends that are colleagues from and help form a network for you, for us around the country. And so, for example, now if I have a question for a surgeon from another part of the country, I can just look through my directory and have all these friends that I've made through RAS and have that question answered. And those friendships form over years of meetings at Clinical Congress, for example, at other surgical professional society meetings. And it really helps form this network for us within the House of Surgery for our careers.
Thank you very much for your time. Thanks for your insights, and thanks for your leadership with RAS-ACS. As I said earlier during this interview, I always enjoy your reports during our Regents meetings, albeit they these days by Zoom. But nonetheless, keep up the great work you're doing and keep recruiting other young surgeons. You and your colleagues, or your associates, I should say, are clearly the future of patient care in the United States, and we rely on you. It's very comforting to know the high quality and dedication of the people to whom surgery will be left when the rest of us eventually retire.
Thank you, Dr. Wexner. Thank you for your time.